All right. Welcome back, everybody.
Okay, is this the new one?
Yeah, this is the new one, so
All
you're
right,
good now.
got it.
Now, I think that we're good now. Everyone will give everybody a chance to join us here. Thank you, everybody. Good evening, good evening, good evening, good evening. Welcome to the second try tonight.
Oh my
Instagram had
God.
some issue. That
See,
was
you were
hilarious.
used to these things, so you bought some water or something. I have a
Yeah,
little
yeah.
bit of water left as I've been sitting at this desk all day.
All right. Good evening, everybody. Good evening. Good evening. Yeah, this is one of four home setups, and Mr. Hayes, so I try to keep everything different. All right. So welcome everybody to the Thursday, April the 9th, Brandon's briefing with Council President Brandon Scott. Tonight we have a very, very, very special guest, my good friend, my brother, Senator Antonio Hayes from the 40th District with us. Wish him a great hello. We are going to talk with the senator tonight about COVID from a state perspective and allow you to ask him questions and me questions. But first, just want to give you guys the information, the latest information. Thank you for joining us as always. So, as of today, there are 6,185 cases of COVID across the state of Maryland. There are 638 in the city of Baltimore. And today, for the first time, Governor Hogan released this information by race. This is something that you know that I put in legislation for at the local level, that the senator and folks and Delegate Mosby are pushing for at the state level. And what we have found out is that Black people are contracting COVID and dying from COVID in Maryland in a disproportionate way. So, what we need people to do is everyone has to take COVID-19 very seriously. But this now, really, I'm talking to Black people. We got to stop with the rumors. We got to stop with the urban legends and myths. Yes, Black people can contract COVID-19. Yes, we can die from it. And the reality is that we're dying from it at a higher clip than anyone. So we must practice social distancing at every turn and treat COVID-19 like the crisis that it actually is. With that, we also know that today I asked my legislation Monday asked for the city's health department and the mayor's administration to share not just racial data but zip code. They did release zip code data today. We're going to put the link for people to be able to see that information, and we're going to continue to press to make sure that we have the racial breakdown as well. So now we will turn it over. I will turn it over to my good brother Senator Hayes to introduce himself to everyone, and then, Senator, if you can just right after that go straight into some of the big items that you've been able to get done in COVID, and then I have some COVID specific questions for
Absolutely. For the second time tonight, here,
you.
live with Brandon Scott, Senator Antonio Hayes from the 40th District. Before I go on, brother, I'm glad that we had an opportunity to do this a second time. I just wanted to again publicly wish you a happy belated birthday,
Thank
and absolutely, and thank you for taking on this opportunity to lead. Senator Antonio Hayes from the 40th District. I represent most of West Baltimore, from downtown all across the city. Probably my district is a microcosm of Baltimore City. It has some of its strengths, some of its challenges, and some of its opportunities. I represent everything from Harlem Park to Hamden, Park Heights to Pigtown. And you know, for 4 years, I had the opportunity to serve in the Maryland House of Delegates. I've served in the state Senate for 2 years, and it's been an awesome responsibility to do so that I take very, very seriously. Being one of 47 senators representing one of the greatest cities in our nation, Baltimore City. Speaking of which, I'm very thankful and grateful to my colleagues in the Maryland Senate, especially those from Baltimore City, who have seen confidence in me to elect me to serve as the chair of the Baltimore City Senate delegation, where we have shown a tremendous amount of leadership, and we've stuck together as a unit when things are tough and hard issues come up, especially as they relate to Baltimore City. And I think you'll see a lot of that reflected in, the passage of the Kerwin Commission, and I mean the Kerwin recommendations, and other pieces of legislation that passed this session.
thank you, Senator. Thank you for that. Also, just talk about like at the state level, what are some of the COVID specific things that you guys have been pushing for? And also, how do you think moving forward, COVID-19 is going to impact the state of Maryland from a health perspective, but also in a fiscal perspective? Like, what should the residents of Baltimore City and all of Maryland be thinking about when we think about how COVID is going to have an impact on us?
Yeah, I think one of the biggest things that we did, we had a piece of legislation that came before my committee. I think it was Senate Bill 1079, which gave some additional authorities to the governor of the state of Maryland to take quick action, even with the legislature being adjourned. And so I think a lot of the work that we did early on in March and April to see that this legislation get passed, the governor has the leeway to continue some of that work. But we also understand that there still need to remain checks and balances in our government. And so we, in addition to, passing legislation, giving the governor additional authorities, we've continued to make sure that we have an advisory committee to review some of the things that are going into place. And, there's been talk of, I'm not certain how sure we are, but there has been conversation about possibly going back into session in the middle of May to deal with some things that may have been left on the table. I think, one of the things we did right before we left was make sure we had a balanced budget. It's, one of the things, we're not like the federal government. We have to balance the budget every year. And it's important that we did that, because come July 1st, had we not had a budget in the state of Maryland, that would have been thousands of Maryland employees that would have been laid off from state government. So we wanted to make sure that we put government would still function on behalf of the people we serve, while also dealing with the crisis. We don't know what effects the economy will have on that budget. And so I would, definitely speculate that maybe not May, I don't know when, but at some point in time prior to the next legislative session, there may require additional action on behalf of the legislature.
Great, thank you. And just remember, everybody, please be sure to send your questions in. We're going to get to all of your questions in just a second. If you have questions, send them in right now. Senator, talk about how, two things I want to hear from you about. So what do you think about the racial disparity we're seeing in the COVID numbers? And then also, how is COVID impacting the 40th district?
Right. And so I think, serving on the Senate Finance Committee, we deal with a lot of health policy issues. And you look at the, the disease of substance abuse, the disease of diabetes, and elsewhere, we continue to see along the spectrum of healthcare there have been disparative concentration of, people of color that have a lot of these things. I think COVID having such a dramatic effect on one's respiratory system puts a lot of people with, coexisting, illnesses at stronger opportunity to pass away. Just wanted to pause for a minute and thinking, we just lost one of our closest friends today, a very active member in our community who has been a leader and helping a lot of nonprofit organizations throughout the city and throughout the state. Just lost his lovely wife this evening. I don't know, when I found out, it kind of hit me by surprise, because every time you see them as a couple, they're so young and vibrant. And so it was shocking to see Adrian go through this. And so, our love, respect, and prayers go out to Adrian and his family. But, one of the things, and I'm glad that you've taken on the opportunity and the leadership to get the message out there. If anything else, and hopefully we could get that accomplished in this broadcast, is making sure people take this seriously, because COVID is seriously taking lives throughout our world.
Thank you. Yep. And then just talking about that too, Senator Hayes, and some of the things that people want to talk about with a state representative. When you think about Maryland, right? in the position that we're in, how close we are to DC, how many government workers work here. How do you think the impact of COVID on Maryland would impact the rest of the country?
Yeah, I think the state of Maryland is one of the largest employers in our state, and that's why it was really important that we passed the balanced budget, because also a lot of Maryland employees, they often serve as the safety net for the most vulnerable families and children in our communities. And so if for whatever reason we did not pass a balanced budget and we would have come to a screeching halt, like the federal government has done and shut down in previous years, we wouldn't have the help and the support of Department of Labor, which provides unemployment opportunities to so many vulnerable families that through this crisis have lost jobs. If we wouldn't have passed the balanced budget, we wouldn't have had the help and the support of so many dedicated men and women who step up to the plate and every day to work for various departments of social services throughout our state, making sure young families are protected, and making sure that young people who are subject to abuse and neglect are taken care of. SNAP is also another benefit that a lot of Maryland families depend on to, put food on their table. And so it was really, really important to all of us that we, one, gave the governor the tools he had to make sure that government continued to work, but also to keep those Maryland families who were employees of the state of Maryland working to help some of the most vulnerable among us. And being in Maryland and being so close to our nation's capital, and especially Baltimore City, being probably one of the most densely populated areas in the region, it could have a devastating effect, especially if we're hit really hard and the outbreak spreads.
Thank you. I want to give a shout out to Councilman Chris Burnett. I saw he just popped into the live
Yes.
feed. Question. So we're going to get to your questions. If you have questions, please send them in. We will get to your questions. We're going to start with the first question. This one, Senator Hayes, is for you. What about layoffs and potential layoffs and furloughs for state employees?
There's been no conversation of that right now. Like I said, it's times like this when all else is awry, businesses are closed, and others, where government really provides an opportunity to be that safety net for a lot of families. That hasn't been a part of conversation where we're actually having layoffs or whatever. I think some of those safety nets that exist because state government is still running would, make a bad situation even worse. But that have not been at least a part of a conversation. I would hope that the governor would not consider that, as many Marylanders are dependent on Maryland employees to take care of them.
Thank you. And then someone had a question you actually brought up. Someone said they keep seeing people should apply for SNAP benefits regardless of income. Is that true? The answer is no. We know that absolutely not. There are still always there income limitations to that. So be sure to make sure that you're within those. But remember, again, you can always find all of the available food programs and stuff by simply just going to bit.ly/BeMoreCOVIDMap, bit.ly/BeMoreCOVIDMap. So we're going to continue to put out the information for you guys each and every day. Also want to remind everyone that we're now going to have Pimlico is going to be a testing site in 21215, which is the highest zip code in the city for COVID-19 right now. It's a public-private partnership with LifeBridge Health, the Stronach Group, the Maryland National Guard, the City Health Department, and the Maryland Jockey Club. But another reminder, do not just rush there and try to drive up and get a test. Testing is by appointment only beginning tomorrow, and you have to have a doctor's note. People can call into 211 to inquire about testing. They'll be screened over the phone. If callers meet the eligibility requirements, they will be directed to come to the site at a specific time. So do not think that you can just rush up there and get tested. We want everyone to do this in a very, very, very safe way.
Yeah, and the most important thing, and you know, number one, if you think you have the symptoms or whatever, just contact your primary care physician. You know, there's so many, you know, especially in our communities, a lot of people try to, you know, they have these old home remedies. You know, I think now is the time where we should take this thing seriously, and if you have any symptoms, contact your primary care physician.
And if you don't, again, if you don't have a primary care physician,
Yeah.
call 211. They will direct you to
Yes.
one of the clinics that you can get there. So again, someone says, can you list all the testing locations in Baltimore City? Listen, again, the testing locations are only right now with a doctor's note at the advice of a doctor. So again, as the senator just said, if I say consistently day after day, unless you have the very severe symptoms or pre-existing conditions, you don't need to rush to get a test. Call your doctor first. If you don't have a doctor, call 211. Call your doctor first,
First.
and they will walk you through whether you need to go get tested or whether you're just going to have to sequester yourself at home and ride it out. That's what we have to do. They're going to be doing, listen, they're going to be doing testing at Pimlico. I actually don't know which test they're going to be administering, but the thing that really matters is that people in the zip code, in the area where we most need it, are going to be able to get the test. It's a great question.
Yeah, and
Senator,
they should start testing there as soon as this week, correct?
tomorrow is
Yeah.
supposed to start tomorrow.
Yeah.
Tomorrow at 10 a.m. The test will start there tomorrow at 10 a.m. And we just had to make sure that people are being safe. And I think this is something else I wanted to bring up again, like I brought up yesterday, right? We can't have people dropping their gloves and stuff all over the place. That creates another public health issue, right? Throw them in the trash. They shouldn't go into the toilet either. Throw them in the trash, dispose of them properly so that we can help stop the spread of COVID-19. And just also another reminder that Safeway and Giant and supermarkets are now starting to limit the amount of people that are in the store at one time, right? We have the senior hours in the morning in most of those cases, but then now, period, they are limiting the amount of people in the store. And what I'm going to advise anyone that can do this, I'm going to advise you to order your food online and try to prohibit yourself from going to the supermarket. But if you have to, know that it's not going to be a case where you can just walk in anymore. You're going to have to spend some time doing that and practice social distancing even greater than when you were there before.
And another important note about about the supermarkets for our seniors, especially because there's going to be long crowds and possible waits. Each of the supermarkets typically have very early morning hours available to our seniors, anywhere between 6 and 7 o'clock. And so, reach out to the stores, look on the website for grandma, auntie prior to rolling out, but make sure that seniors are not waiting in these long lines and take advantage of those opportunities that's
Yeah.
available to them.
And Senator, this is what I tell people every day. If you got your mom and dad's a senior, your grandma, go buy their grocery for them and then leave
Yep.
it on the porch. Allow them to come get it. You don't need to go inside their house. I know it's hard that we're not being able to see be with our grandparents and things like that. It's killing me that I won't get any of my grandma's potato salad for my birthday or for Easter this weekend. But it's the right thing to do. We have to practice social distancing at every turn. And you can actually find the hours of the senior hours on our Be More COVID map at bit.ly/Be More COVID map. Senator Hayes, before we let you out of here, man, is there anything else that you want to give to the great people on Instagram?
No, I just want to urge everyone to be safe. You know, I've tried to travel very seldomly. I've been spending a lot of time here in the house, you know, trying to stay as safe and trying to lead by an example. But sometimes it necessitates that we go out. But I still, unfortunately, see a lot of people on the streets. And I think, you know, all of our local officials and authorities, as well as state government, has been very deliberate in trying to get information out and patient. One of the things that I'm afraid of is that like New York and other places who are setting up makeshift morgues, if we don't take this seriously, it will begin to claim more and more lives in our community. So please, 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 I don't think it takes the National Guard, as some people think that the streets won't be clear until the National Guard. I believe Baltimoreans are better than that. I think that we will be responsible enough to govern ourselves accordingly and stay inside and make sure our families are safe from harm. But please, family, if you can avoid it, please do stay in the house. Do not go outside and especially, avoid being in large crowds. It may seem, when this thing first started, Mr. President, it felt real uncomfortable to me to ask another individual to give me a little bit of space, right? Because I'm a very personable and social person. But it's just necessary that we do this to make sure that we're protected and all of us are protected. And as rude as it may seem or uncomfortable as it may seem, because we're generally a social group of people who like to have close contact. Now is just not that time, right? There's a lot of ways to show love, and the way you really show that love is making sure everyone's health and safety. And so I urge everybody at home and all over. And I like this live thing that we're doing here tonight. Hopefully, people have learned something from this experience and get it out to their neighbors and their loved ones. I might even do one myself, sir.
There we go.
So we can help get the word out. But thank you for providing the platform and the opportunity for us to get the message out there to our constituents.
Thank you for joining us, Senator. And also, I just want to point this out. Someone said, where can they get the zip code information? We're going to paste that link in this chat right now for you to have. We want, as the senator said, we have to take this very, very seriously. We're going to make sure that we're continuously communicating with you. But we need everyone to practice social distancing. We need everyone to have fun in their house. We need people to just do with the advice of the public health professionals so that we can stay alive, y'all. This is what this is.
It's important.
Your life depends on it because it absolutely, positively does. Today, tomorrow, your family's lives depend on it. Your friends' lives depend on it. Things that we're doing are not appropriate. Like, you can't be having parties at your house. It's going to have to be done virtually. You can't be getting your hair cut, like I said, continuously. Like, I'm going to be lining myself up because it's just a responsible thing to do. My barber is my cousin. So if I'm not allowing my cousin, who has cut my hair since I was like 6 years old, to cut my hair, then no one should be getting their hair cut or done unless the person lives in your household. Don't do it because you can be helping to spread this disease. It may take you or may take your family member, may take your person that you love very dearly. So everyone, please stay safe. As always, Senator Hayes, thank you. We look forward to seeing you live. That you have joined us in the 21st century. Thank you always for your great work. And everyone, be safe and be sure to follow us both on social media. You can find me at Council Prayers BMS, and Senator, where can the good folks find you?
Antonio Hayes 40 on Instagram, Facebook, and Twitter. That's Antonio Hayes 40. Check us out. Or also, another thing, and I'm sorry I didn't give this shameless self-promotion, but on my website, antoniohayes.com, we've created an entire COVID-19 page where when we get information, we share that with you. So check it out and, feel free to pass it on to a friend or a neighbor.
All right. Thank you. Thank you, Senator Hayes. Always much love. Everyone have a great evening. Eat a great dinner with your family. Peace.